What if one of the biggest threats to your heart is not what you eat during the day, but what happens after you fall asleep at night? I want you to think about that for a moment. You go to bed, the lights are off, the house is quiet, and everything seems normal. But for millions of people, breathing begins to stop and start over and over during sleep. Most do not know it is happening. They may think they are just snoring. They may think they are simply getting older. They may blame stress, a busy week, or a poor night's rest. But this hidden sleep problem can put real strain on the heart and brain, and over time it may raise the risk of high blood pressure, heart attack, stroke, memory trouble, and deep daytime exhaustion. If you wake up tired, foggy, or with a dry mouth, or if someone has told you that you snore, gasp, or seem to stop breathing in your sleep, this video could matter more than you realize. I want to talk about this in a calm and caring way, because I know health topics can feel heavy. My goal is not to scare you. My goal is to help you notice what many people miss. And here is the hopeful part right from the start. When this problem is recognized and treated, many people feel better than they have in years. They think more clearly. They have more energy. Their sleep improves. Their partner sleeps better too. And in many cases, getting help may also support heart health and overall safety. So please stay with me, because later I am going to share one simple question that can help you spot this sooner, and one very common mistake older adults make when they try to explain away the symptoms. The condition I'm talking about is sleep apnea. In simple words, sleep apnea means your breathing stops and starts many times during sleep. These pauses may last for seconds, and they can happen again and again through the night. Some people have a blocked airway, which is called obstructive sleep apnea. Others have a problem with how the brain signals breathing, which is called central sleep apnea. The names matter less than the basic idea. Your body is not getting smooth, steady breathing all night long. And when breathing is disrupted, deep, healing sleep is disrupted too. That means your body may be fighting through the night when it should be recovering. Before we go deeper, if you have ever woken up feeling like you slept all night, but still felt worn out, tell me in the comments with one word, tired. If someone has told you that you snore loudly, comment snore. If you wake with headaches or a dry mouth, tell me that too. I read your comments, and they help shape the videos I make for this community. And if you know someone who falls asleep in a chair, snores loudly, or seems exhausted every morning, please share this video with them. Sometimes a gentle conversation can open the door to real help. Now let's make this easy to understand. Why does sleep apnea matter so much for heart health? Because every time breathing stops, oxygen can drop. The body senses stress. Blood pressure can rise. The heart may have to work harder. The brain may briefly wake the body to restart breathing, even if you do not remember it. That means you are not getting the kind of deep, steady rest your heart, brain, and blood vessels need. Night after night, month after month, year after year, that strain can add up. It is not just about feeling sleepy. It is about what repeated stress may do to the systems that keep you alive and independent. Here is the part many people miss. The problem is not only the snoring. In fact, some of the most important moments are the quiet ones. A husband may hear his wife snoring, then suddenly there is silence, then a gasp. A wife may lie awake listening to her husband snore, then stop, then choke, then begin again. That pause is not something to ignore. It may be a clue that breathing is being blocked. And if you live alone, you may never hear it. That is why so many people miss it for years. They do not hear the pauses. They only feel the consequences the next day. Those consequences can show up in ways that do not seem related at first. You may wake up with a dull morning headache. You may feel like your brain is wrapped in cotton. You may feel short-tempered for no clear reason. You may find yourself needing a nap, drifting off while watching television, or feeling sleepy in the afternoon even when you think you slept enough. Some people notice memory slips. They forget why they walked into a room. They lose their train of thought. They blame age. They blame stress. They blame themselves. But when sleep is broken again and again all night, the brain and body pay a price the next day. I often hear older adults say, "I thought waking up tired was just part of getting older." I want to be very gentle, but very clear here. Aging can change sleep, yes. But feeling exhausted every morning, feeling sleepy all day, or waking up gasping is not something you should simply accept. Another person might say, "I just have stubborn blood pressure." That could be true, but here is something worth knowing. When blood pressure is hard to control, sleep apnea can be one piece of the puzzle. Not always, but often enough that it deserves attention. If someone is taking their blood pressure medicine the right way and numbers are still hard to manage, sleep quality and breathing at night are smart topics to bring up with a doctor. Let me give you a simple example. Imagine a man in his late 60s. He goes to bed at a normal hour and thinks he sleeps through the night. But in the morning he feels drained. He starts depending on more coffee. He falls asleep in his recliner. His wife says his snoring has become thunderous and sometimes it sounds like he stops breathing. He brushes it off. He says he is just tired. Over time, he becomes more forgetful and more irritable. His blood pressure remains high. In a story like this, many people focus on the daytime symptoms and never ask the most important nighttime question: what is happening to his breathing while he sleeps? Sleep apnea is common and risk can increase with age. Carrying extra weight can raise the risk, especially around the neck and upper body, because it may narrow the airway. Alcohol in the evening can relax the throat too much. Some sedating medicines can also make nighttime breathing problems worse in some people. Nasal congestion may matter. Men are often diagnosed more often, but women can absolutely have sleep apnea too, especially after menopause. People with high blood pressure, type 2 diabetes, heart disease, heart failure, or a past stroke should be especially alert to the possibility. And if a family member has it, that can matter too. Now I want to slow down and talk about symptoms, because this is where many viewers suddenly realize, wait, that sounds like me. The most well-known symptom is loud snoring. But not everyone with sleep apnea snores, and not everyone who snores has sleep apnea. So we have to look at the full picture. Other warning signs include gasping or choking during sleep, waking up with a dry mouth, morning headaches, trouble staying asleep, feeling very tired in the daytime, poor attention, memory issues, mood changes, and irritability. Some people wake up several times to use the bathroom and never connect it to poor sleep quality. Others wake up feeling their heart racing. Some simply feel unwell and cannot explain why. That matters because sleep apnea can affect more than energy. It can affect safety. A person who is very sleepy in the daytime may be at higher risk of falling asleep at the wrong moment. They may doze off while reading, sitting, or even driving. Their balance may feel worse because exhaustion can make the body less steady and the mind less alert. Caregivers often notice changes before the person does. They see the snoring, the pauses in breathing, the daytime nodding off, the forgetfulness, the mood changes, the loss of interest, or the growing confusion. If you are a caregiver, please trust what you are noticing. You may be seeing signs of a treatable problem. Now let's talk about the connection to heart attacks and strokes in a clear and honest way. Sleep apnea does not mean a person will definitely have a heart attack or stroke. I want to say that plainly. But untreated sleep apnea has been linked to higher risk of high blood pressure, stroke, heart disease, irregular heart rhythms, and other serious problems. One reason is the repeated drop in oxygen. Another is the repeated activation of stress responses in the body. Over time, that can put strain on blood vessels and the heart. If a person already has heart disease, these nighttime breathing problems may be even more important. That is why doctors and heart specialists take sleep apnea seriously. There is another detail many people overlook. Poor sleep can affect blood sugar and weight too. When sleep is broken and the body is stressed, healthy routines become harder. People crave more food. They move less because they are tired. Their body may respond differently to insulin. So sleep apnea can become part of a bigger cycle. A person feels exhausted, gains weight, blood pressure rises, blood sugar becomes harder to manage, and sleep gets even worse. This is one reason fixing sleep is not a small issue. It can touch many parts of health at once. Here is a question I want you to remember. Do I feel refreshed when I wake up? Not just awake. Refreshed. If the answer is no most mornings, that is useful information. Another important question is this: has anyone ever told me I stop breathing, snort, or gasp in my sleep? If yes, please do not ignore it. Many people laugh it off. They say, "Oh, I snore like a bear." But repeated gasping or pauses are not a joke. They are clues. And clues are how we catch problems early. I also want to talk about women for a moment, because women with sleep apnea are sometimes missed. They may not always describe their symptoms the same way. They may talk more about insomnia, fatigue, headaches, anxiety, poor sleep, or low energy instead of loud, obvious snoring. After menopause, risk can rise. So if you are a woman who feels drained, wakes often, has headaches, or cannot think clearly, please do not assume it is only stress or age. It may be something worth checking. If you live alone, you may be wondering how you would ever know. Start with the morning clues. Do you wake with a dry mouth? Morning headaches. A heavy, tired feeling even after plenty of time in bed. Do you struggle to stay awake in quiet moments? Does your concentration feel worse than it should? If you track your blood pressure at home, is it often high or hard to control? You can also ask a family member if they have ever heard you snore during trips or naps. And if you use a phone or watch that tracks sleep, remember that these devices can sometimes offer hints, but they do not replace a real medical evaluation. Let's talk about diagnosis, because sometimes fear of the unknown keeps people from taking the next step. A healthcare professional may ask you about symptoms, your sleep habits, your blood pressure, your medications, and whether anyone has noticed snoring or pauses in breathing. You may be referred for a sleep study. That sounds bigger than it is. A sleep study simply looks at how you breathe, how your oxygen levels behave, and how your sleep is being affected. Some people do a study in a sleep center. Some may have a home sleep test if their doctor thinks that fits. The point is not to give you a label. The point is to get answers so you can make a wise plan. Now here is where some people get nervous. They think, if I find out I have sleep apnea, what happens next? Treatment depends on the person and the cause. A very common treatment is CPAP, a machine that uses gentle air pressure to help keep the airway open while you sleep. I know that idea can sound uncomfortable. Many people imagine a giant mask and a terrible night. But modern equipment is often better than people expect, and the right mask fit can make a big difference. Some people say the first week feels strange, then they begin to sleep better, wake clearer, and wonder why they waited so long. CPAP is not the only option in every case. For some people, treating nasal congestion helps. For some, losing excess weight may reduce strain on the airway. Some people benefit from sleeping in a different position. Dental devices that help keep the airway open may be used in certain cases. In some situations, surgery is considered. The key idea is this: there is no one-size-fits-all answer, and no one online can tell you what your body needs from a distance. But you do have options, and that is important. This is also the right time to say something very important about medications and supplements. If you take sleep medicine, pain medicine, or anything that makes you sleepy, do not stop it suddenly on your own. And please do not start random supplements, because someone promised a miracle fix for sleep apnea. Talk with your doctor or pharmacist. Some medicines can affect nighttime breathing, but changes should be made safely and with guidance. The goal is not to guess. The goal is to protect you. Now I want to share one of the most practical insights in this whole video, because this is the part many viewers tell me they needed most. If you suspect sleep apnea, do not go into your appointment saying only, "I'm tired." That is too easy to brush past. Be specific. Say, "I wake up exhausted even after 7 or 8 hours in bed." Say, "My partner hears me gasp or stop breathing." Say, "I wake with headaches and dry mouth." Say, "I get sleepy in the daytime." Say, "My blood pressure is hard to control." These details help your doctor connect the dots. A vague complaint may be overlooked. A clear pattern is much harder to ignore. Let's move into simple daily habits that support better sleep and may help lower risk while you are getting checked. Try not to drink alcohol close to bedtime, especially if you already snore or feel unusually tired in the morning. If you have nasal congestion, talk with your healthcare professional about safe ways to manage it. Keep a regular sleep schedule when possible. Work on heart-healthy habits during the day, like gentle movement, balanced meals, and taking your prescribed medicines as directed. If your doctor has told you that weight loss would help, even small progress may matter. But do not treat these habits like magic cures. They are supportive steps, not a substitute for proper evaluation. Caregivers, I want to speak to you directly for a moment. If the person you love snores loudly, stops breathing in sleep, wakes confused, or seems dangerously sleepy during the day, your observations are valuable. Write down what you see. How often does it happen? What does it sound like? Is there gasping? Does the person wake with headaches or seem foggy and short-tempered? Does the sleepiness affect driving, walking, or mood? That information can help a healthcare professional see the full picture. Caregiving is hard, and sometimes you are the one holding the clues no one else sees. There is another important angle here, and it has to do with independence. Many older adults tell me their biggest fear is not getting wrinkles or grey hair. It is losing control over daily life. It is being too tired to enjoy the day, too foggy to remember things, too sleepy to drive safely, too worn down to exercise, too unsteady to trust their own body. That is why sleep apnea matters so much. Better sleep is not just about comfort. It is about staying clear-minded, steady, active, and involved in your own life. Now, because we are talking about the heart and brain, I want to calmly review red flag symptoms that need urgent care. If you ever have chest pain, sudden severe shortness of breath, fainting, new severe confusion, or signs of stroke such as one side of the face drooping, weakness in an arm, trouble speaking, or sudden trouble understanding words, do not wait to see whether it passes. Get emergency help right away. Those symptoms should never be brushed off as just poor sleep. Sleep apnea is important, but emergencies are emergencies. You may be wondering, if I already had a stroke or heart problem, is it too late to care about sleep apnea now? No. It is still worth discussing. In fact, that is one of the most important times to bring it up. People with existing heart or brain conditions may have even more reason to ask about sleep breathing problems. Again, that does not mean sleep apnea caused everything. It means untreated breathing problems at night may be one more burden on a body that already needs support. If you or a loved one has a history of heart disease, irregular heartbeat, stroke, or heart failure, ask whether sleep apnea screening makes sense. Another common myth is that only people who are very overweight get sleep apnea. Weight can be a factor, yes, but it is not the full story. Some thinner people have it. Some people have airway shape issues, family patterns, nasal blockage, or other risk factors. So please do not use body size alone as the test. If the symptoms fit, the conversation is still worth having. On the other hand, some people assume every snorer has dangerous sleep apnea. That is not true either. This is why medical evaluation matters. We do not want panic, and we do not want denial. We want clear thinking. Here's something else many people miss. Sleep apnea does not always look dramatic. It can look ordinary. It can look like someone who is just tired all the time. Someone who keeps needing naps. Someone who becomes more forgetful. Someone whose mood has changed. Someone who says, "I don't know what's wrong with me lately." That quiet, ordinary look is one reason it hides so easily. It does not always announce itself with a big event. Sometimes it whispers for years before anyone listens. If you are younger and watching this for a parent, grandparent, or spouse, please know that how you bring this up matters. Try kindness instead of shame. Do not say, "You sound awful when you sleep." Say, "I'm worried because I hear pauses in your breathing, and I want to make sure you're okay." Do not make it a joke. Do not make it an attack. Make it an act of care. People are much more likely to seek help when they feel respected. And if you are the one hearing this and thinking, "I know I should get checked, but I'm embarrassed," please hear me. There is nothing embarrassing about protecting your heart, your brain, and your sleep. Snoring and sleep apnea are medical issues, not moral failures. You did not fail because your airway closes at night. You deserve answers, just like anyone else. Let me bring this back to the title of this video in the most honest way possible. People really are doing something in their sleep that may raise the risk of heart attack and stroke, and that something is repeated interrupted breathing. Not everyone who snores has this. Not everyone with sleep apnea will have a heart attack or stroke. But this is a real health issue, and it deserves more attention than it gets. The reason I made this video is because so many people live with the signs for years and never connect them. So what should you do after this video ends? Start with one simple step. Ask yourself whether your mornings and your days are telling you that your nights are not going well. If you share a bed, ask what your partner has noticed. If you live alone, write down your symptoms for a week. Morning headaches, dry mouth, daytime sleepiness, memory fog, snoring reports, high blood pressure, waking up gasping, trips to the bathroom, restless sleep. Then bring that list to your doctor. That small action can turn confusion into a plan. And if you are already being treated for sleep apnea, let this be your encouragement to stay engaged. If your mask is uncomfortable, ask for help instead of giving up. If you are not sure your treatment is working, follow up. If you have new symptoms, say so. Treatment is not about perfection. It is about progress and support. Many people need adjustments before things feel right, and that is okay. I want to end with this. Your body speaks in patterns. It speaks in fatigue, headaches, snoring, dry mouth, brain fog, hard to control blood pressure, and gasping in the night. Too often, we hear those signals and call them normal aging. But sometimes they are warning signs. Gentle ones at first, then louder ones over time. The good news is that you do not have to solve this alone, and you do not have to ignore it. A better question, a better conversation, and a better plan can make a real difference. If this video helped you, tell me in the comments what symptom or sign stood out most to you. And if there is someone in your life who wakes up exhausted, snores loudly, or seems to stop breathing during sleep, please share this video with them today. It could help them ask the right question at the right time. Take care of yourself, protect your sleep, and remember that good rest is not a luxury. It is part of how we protect the heart, the brain, and the life we want to keep living.